Indiana is considering a change to how Medicaid pays for prescription drugs. So under this proposal, FSSA would eliminate 340B savings.
And that could threaten access to medicine and care for low-income Hoosiers and strip millions from safety net clinics across the state. So what is 340B savings? What are safety net providers? And why should we even care? Here to help us answer those questions is Alan Witchey, President and CEO of the Damien Center. Thank you for being here. Can you explain the 340B pricing program?
Yeah, in a nutshell, what happens is 340B is a discount program where you can buy medications at a discount if you are a very specific provider, and then you bill for the normal rate for those reimbursements. And the difference between those two goes into health care for low-income populations. So it costs $0 for taxpayers. All of the funding comes from pharmaceutical companies, and they participate in this program. So it's $0 for taxpayers, and it gets millions of dollars to low-income Hoosiers, and it gets them free or very reduced health care and medications, and all of that's at threat right now.
I was going to say, so what happens to that money under this change?
Well, in this change, that money would go directly to FSSA and Indiana Medicaid, but only a third of it. Because we're a Medicaid expansion state, 2/3 of it goes to the federal government. So this is a terrible decision because it takes money out of the safety net system for low-income Hoosiers, sends it to the federal government, and only keeps a small portion for the local government. And it makes no sense. And millions and millions of dollars will come out of health care for Hoosiers that deserve it, because this is not tax dollars.
So you already have touched on it, but how is this impacting Hoosiers, patients day to day?
Yeah, I mean, there's health clinics across the state, many in rural communities, that will likely go out of business or really just dramatically scale back. For us, it's millions of dollars out of our budget that helps pay for people living with HIV to get their medications or primary care medications. And so less Hoosiers will get their medications under this model.
So there is a call to action on your behalf, and I know there's a deadline. People can kind of weigh in on this, right?
Exactly.
So what do they have to do?
Exactly. So they need to send a message through to FSSA and tell them not to make this change, because it's bad for Hoosiers, it's bad for the state. It will mean fewer people get medical care, fewer people get medications, and they need to specifically say that they do not think 340B should be moved away from community clinics, because that's so critical for our success and helping Hoosiers get care.
And particularly in the rural community,
yes,
as you have underlined.
Yes.
So we have placed a link to this so you can submit your comment about the 340B pricing program. It's on our website at WTHR.com. We just want to thank you.
Thank you so much
Damien
for
Center.
bringing light to this. Yeah.